Hey everybody, thanks for coming to our final city forum of the spring semester. Looks like the weather has kept a lot of folks away and also end of semester commitments, but thanks for being here. I'm Alex Carner, Associate Professor of Community Regional Planning and the Faculty Coordinator for City Forum. Today we've got Kevin Lanza as our final City Forum speaker. So Kevin is an Assistant Professor in Environmental Health at UTHealth School of Public Health. I'm going to try to say health as many times as possible. His research explores the relations between the environment, health behaviors, and health through an equity lens with a focus on extreme heat and physical activity of children and other heat-sensitive populations. The goal of his research is to inform policies that eliminate health inequities based on race, ethnicity, and class in the face of climate change. Prior to joining the faculty at UTHealth, Dr. Lanza was a research fellow at the Centers for Disease Control and Prevention. He received his doctorate in city and regional planning from Georgia Tech, which is where I first met him. It's been very exciting to see his trajectory and to see him turn into a rising star over these past few years. And he completed his postdoctoral training in the Michael and Susan Dell Center for Healthy Living. His work has been funded by the National Institutes of Health, NOAA, the Robert Wood Johnson Foundation, and the City of Austin. So let's welcome Kevin to City Forum.
Thank you, Dr. Carner, and thank you all for coming on this interesting weather day in Austin. We'll talk a little bit about weather conditions through this talk, specific to extreme heat and how it relates to health and well-being. There are lessons from Texas through my research, along with my co-investigators I'd like to share with you today. So this talk has a few parts to it, kind of really two major chunks. The first part, which will be the shortest amount of time, will be really what's some background information on the relations between heat, health, and well-being of different populations in Texas and beyond. And then next I'll dive into my research, specifically 6 different research projects. It sounds aggressive, but I promise it tells some type of story here. So first, let's start with some of that background information. And also, at any time, if there's a burning question you have about a particular slide or something I say, feel free to just raise your hand and we can kind of answer that. Or we can wait till the end, either way. So we've understood across the world, both the land and the water, average global temperatures have been increasing over time. So historically, it's occurring. What this figure shows here are differences in temperature in Fahrenheit with respect to the 20th century average, which was 57 degrees Fahrenheit across the world. You can see that around 1980 and forward is when every single given year has been hotter than the 20th century average. And the last decade has been hotter than any other decade on record. This starts in 1880 because that's when we first had representative ground data across the world where we can make these estimates. So truly when we say it's the hottest year or hottest decade, it really is, at least measured. Along with those average global temperatures increasing over time, we've seen an increase in what are called extreme heat events or heat waves. And there's no standard definition for a heat wave, but we can call it 2 or more consecutive days of abnormally high temperatures. So heat waves have increased in frequency, how often they happen, duration, how long they last, season, how long the period of when heat waves may occur can take place, along with how hot they get. This is in the US and other places, including Australia. Now, we've seen that historically temperatures have been increasing, and we've seen that heat wave events have been increasing, but also we're projecting outwards that temperatures are going to continue to increase over time. What we see here are data from Travis County, Texas, that's where we are now, and we see the number of days above 95 Fahrenheit or 35 degrees Celsius. You can see under 2 different greenhouse gas emission scenarios. Intermediate emissions, which is more or less emissions continuing across the world until about 2040, where policy allows for a precipitous decline in emissions, and a high emission scenario, representative concentration pathway 8.5. That's where more or less policy is not checking the amounts of emissions, and we're continuing to emit in perpetuity. You can see that currently around 2020, about 75 days a year under both scenarios, above 95 degrees Fahrenheit. Yet towards the end of the century, you're seeing almost a doubling if you're at the high emission scenario. Now, these high temperatures are not only a warm climate issue. So I bring here another example from San Diego County. In lots of ways, that's a beautiful climate where people are moving there specifically to enjoy that sunny weather, Mediterranean-like style. Yet what you see is in 2020, about 40 days a year above 95 degrees Fahrenheit. Yet by the end of the century, if you look at the red line, the high emission scenario, it's over 75 days or about over 80 days a year above 95 Fahrenheit. Pretty much what that means is it's looking like Austin now if we follow that scenario. So We've talked about climate change and specifically how it impacts temperatures, but what do these impacts mean for human health? Here's a conceptual framework from the U.S. Centers for Disease Control and Prevention, which in the innermost ring shows the major climate change impacts, including rising temperatures. In the middle ring, you see how these impacts affect different exposures, including extreme heat. And on the outermost portion, we see how these exposures affect different health outcomes. In my work, I currently focus on this red-bounded area, extreme heat and its impact on health. Why do I look at this? Well, I think it's important. It is one of the most deadly weather-related hazards in the United States, and this is the same with a few other areas across the world. Here we see the average number of annual deaths attributed to different weather-related hazards across the United States, where heat leads to about 150 deaths each year. Now, these are only medically diagnosed deaths related to heat. These are not what are another metric of deaths, which is called excess deaths. That's where they take the normal number of deaths over a given time period, and they see, due to temperatures, if there is a rise or a decrease in those deaths. And if we looked at that type of metric, excess deaths, which aren't shown here, we'd see a precipitous increase in the number of extreme heat-related deaths. Why are people getting injured from heat? Well, it is one of the two ways that their core body temperature raises to a level that's injurious. One way that temperatures rise is by performing metabolic work or physical activity, and another way is being exposed to high temperatures. So if one is being physically active in high temperatures, they're doubly stressing their thermoregulatory system and are at higher risk of heat-related injury and death. Now note that these temperatures here are core body temperatures. These are not outdoor temperatures. Yeah, you're like, wow, 104. Yeah. And so in the earlier conceptual framework I showed on climate change and health, we were pretty much focusing on, in this framework, the backbone, that vertical line of climate change drivers being that inner ring on the last slide, the middle portion being the effect of the climate change impacts on exposures, and then the health outcomes on the bottom. But what this slide adds is some context. It's showing that there are multiple factors that influence climate change and how vulnerable one is to likelihood of extreme heat-related injury or death. And that could be at a very individual or community level, such as the social and behavioral context, knowing that these are risk factors for heat-related death and injury. Yet there are also kind of broader contexts that also impacts one's likelihood of extreme heat-related morbidity and mortality. One of those broader contexts that impacts one's likelihood of heat-related injury is urban temperatures. So there's that term called urban heat island effect. That's when cities are warmer than nearby areas. And we see that it depends on the land cover and how that impacts the temperatures in the spaces. There's really four drivers of the urban heat island effect. It's a lack of tree canopy. It is high amounts of dark building material that absorbs incoming solar radiation and re-emits it near the surface as heat. Third would be waste heat emissions from any type of human and industrial processes, such as using your air conditioning, which actually heats up the environment outside your walls. And then last would be the urban form or geometry. So how buildings and other space or other items are placed within space, and that prevents heat that is trying to off-gas up and back into space from actually escaping and is keeping it near the surface. What we've understood is that heat is a health inequity in the United States, and this is a product of redlining, which is a racist policy in which the home mortgage lenders back in the 1930s were not providing loans in part due to race, ethnicity, and class. That happened in the 1930s and was allegedly disbanded in the 1960s. Yet what we see is that historical policy still has effects on today in those areas, as those areas that were historically redlined are continued to be underinvested in. And so those redlined areas have higher temperatures than surrounding areas in the same cities. And this has been shown across 200 cities in the United States that have been formerly redlined. This also tracks with other exposures, such as the nature contact, the amount of green space, particulate matter in different areas. And one thing we have to recognize when we're thinking about vulnerability to heat is that individuals have their own intersections. An individual is composed of several different characteristics, and these given characteristics shape who they are and where they are, and what is available in their area due to racist ideas, as well as other kinds of policies that play into one's identity. So this brings me to my research program. It's to eliminate these unfair differences in health related to class, race, and ethnicity in the face of warming from both climate change and urbanization. I aim to reach my goal through really three parts. One is to first identify the impact of extreme heat on the health, well-being, and safety of individuals. And then those individuals who are most impacted, I then want to partner with to co-create different interventions or solutions that we then test together to see if they are truly effective. And then lastly, it's making sure that those data that have been created from that intervention testing are then put in a space where they can truly inform policy to make change. Okay, so let's call that part one. That's where we talk about heat, health, well-being, the relations between those. Here we talk about, this is kind of the first study I'll go over. These two studies here in Louisville and Dallas is where we partnered with the Louisville Office of Sustainability as well as Texas Trees Foundation to write some of the first urban heat management studies in the United States. This was during my doctoral training under Dr. Brian Stone in the Urban Climate Lab. So what we did was we identified hot spots within each of the cities at a very fine spatial resolution, about half kilometer by half kilometer. Then at those, across the city, we then integrated different urban heat management strategies, and these were modeled strategies, so they didn't actually physically happen on the ground. We just estimated what they would do to those temperatures. Those strategies included additions of tree planting, along with additions of reflective materials, specifically on roofs. Then we saw how those different strategies would impact temperatures on the ground, and then what that would mean for associated heat-related mortality. So to make that less abstract, I'll show a few examples from that study. Here in Dallas, we saw that across the warm season, May to September 2011, that our modeled temperatures at baseline, so before any strategies were implemented, showed differences across the city in temperature, where the redmost areas on the left-hand image are the warmest. And that's the most densely developed area of Dallas. That's your downtown region. However, on the right-hand side, we had one of our scenarios was implementing tree planting along with reflective roofs in tandem, and we saw that those together had a synergistic effect and truly reduced temperatures quite largely across the city. And then this portion of that same study is the health impact assessment. So what we see on the left-hand side is the low, medium, high number of heat-related deaths across the city. And this is from a health impact model that also took into account the age of the population as well as the density of the population. And that's important to note because there are differences between where the highest temperatures are in the city and where the deaths are, because we know that older aged adults are at higher risk of heat-related illness than others. So it's not a direct one-to-one to where the high temperatures are and where the deaths are. On the right-hand side, you see the benefits, low, no benefit to high benefit being the bluest areas of that combined strategy scenario. So you can see, based on this modeling, we can truly then inform policy as to where to plant these trees and where to add these white roofs. Second study, and this is closer to now. This was back in 2020 on what across, looking at average temperatures across the past 30 years. August 7th sprang up as the warmest day on average in Austin. So just so you know, don't plan your birthday party then. And this was a campaign conducted. I was part of the team that was led by City of Austin's Office of Sustainability, Mark Couder and others, where we had retrieved funds from the National Oceanic and Atmospheric Administration to conduct an urban heat island mapping campaign. This was a citizen science run campaign where, and there's one of our lovely citizen scientists, that drove their vehicles around Austin on this singular day in August in morning, so 6 a.m. for 1 hour, afternoon, 3 p.m., and then evening, 7 p.m., where they drove their car on select routes that we had decided to cover a eastern portion of Austin, which had been historically redlined. And what that device is capturing is both the geolocation, because it has a GPS device on it, along with the air temperature and relative humidity at 1 second sampling rates. So we had all of these data for the traverses of where the cars were traveling across half of Austin. Here are the traverses we drove on that August 7th day. This is specific to that morning drive at 6 a.m. to 7 a.m. And on the left-hand side, you see that driving, those observed temperatures. You can see they're linear. They're on the roads themselves. Red are the warmer areas. And then the team that offered this funding was able to model for us the temperatures between those observations using land cover, land use data, as well as our input data being these temperatures. And that provides the spatially continuous map of half of Austin. You can see that there are differences within this half, where kind of the northwest portion is hotter along with that kind of whole western kind of spine. And so after conducting that study, we actually had a follow-up study where we wanted to advance the modeling by fusing new data that we would collect. And then the second part to that same study that's currently active is we wanted to understand the community experience to extreme heat, specifically in areas that are economically disadvantaged and majority minoritized individuals. And so we did that in an area with high urban heat island intensity that we had mapped in that initial project, and that's that study area in the image. We recruited with true support from Go Austin, Vamos Austin, a nonprofit in the area, and we talked to 18 different adults. And 18, that number chosen because that's when we had reached data saturation in terms of having those interviews and hearing more or less the same types of data from what we were asking. Really, the interview was rather succinct in terms of what we asked. It had two main, got a question here.
Sorry, in the study area, what neighborhood is that? I'm just...
Okay, that is the Runberg region.
Oh.
So yeah, that's like, I think it's formerly called North Austin Civic Association. And so Runberg is one of the main roads, Runberg Lane. And yeah, so great question. Do a lot of work over there. And so interview had two main questions. It was kind of like a hypothetical scenario. Imagine it's 105 degrees Fahrenheit outside. What does your day look like? And we had quite a few prompts related to that. And then in the future, what would you like to see in your community to make it feel cooler? So now I can share with you a bit of the data or outcomes from that study, because I worked within in vivo software where we were able to identify some major ideas or themes that came through all of the 18 interviews kind of synthesized together. In terms of heat exposure, number one, residents were most hot when they were traveling. That could be to school or to work, such as outdoor construction. In terms of heat sensitivity, number two, the most affected by heat were children and those with existing medical conditions, specifically diabetes. Third, physical health. Heat caused tiredness, headaches, dizziness, fainting, trouble breathing. Fourth, mental health. Heat felt uncomfortable and bothersome. I think that resonates with everyone. And then in terms of adaptive capacity, residents used air conditioning, they didn't go outside, and they also changed their data schedule. In terms of barriers to adapting to heat, it was including AC cost, how much it costs to actually run the AC. Just because you have a working air conditioning does not necessarily mean you want to use it all the time. And the lack of trees in their near environment along with shade. And then lastly, in terms of adaptation strategies, so kind of environmental changes that could be supported through kind of the city of Austin and what they can provide. Folks wanted trees, they wanted parks, they wanted water bodies, and they wanted water fountains. Question?
Quick question, yeah. On point one, did folks mention, did mode of travel come up when they were talking about travel?
Mode of travel.
Or were they mostly talking about being outside, walking, cycling?
It's a perfect segue to the next slide.
Okay,
Because some of the pieces in I have some quotes that really show some of these different items, but I don't think it resonated, or it didn't come off specifically comparison between mode, but they did just mention in their conversation how active travel modes, specifically going to the bus, was a major issue with heat. There wasn't any mention of heat in a car, because I think they were probably using their indoor AC, or they were opening the windows.
I think Runberg has one of the lowest rates of car ownership in the city. A lot of people use the bus here.
I'd really like to see that data.
Yeah.
Yeah, that's impressive. And so, quotes from the community impact interviews, specifically the impact of heat on these individuals we interviewed, along with their households, which came up often. I like to be able to go outside and kind of walk around, but there are not a lot of green areas around my neighborhood, so I have to stay indoors. Sometimes my son wants to come walking, but I tell him, no, son, you have to take the bus. You're already walking a little bit, and it's really hot. So this may showcase how a bus is kind of its own kind of type of cooling center. We do not have time to go out because of the hot weather. The day goes by quickly because it's so hot. We want to go out, we do not exercise, we do not walk, we gain weight. That's a loaded statement. Heat impacts us. I get more stressed, I get more tired. I don't feel like going for a walk to de-stress. We take shelter in the house, hoping that the air will keep us cool. It hits us hard because stressed children are also locked in. Heat affects me too much because my husband comes home tired, not in the mood to play with the girls. This last quote, I think, really showcases the cascading effects of heat onto a whole entire household. The husband in this specific quote, we know works outdoor construction from the rest of the interview. And so he is having prolonged exposure outside while also engaging in physical exertion, which we know complicates and leads to higher risk of heat injury and just discomfort. And then it affects, he can't be who he can be with his children, and this is affecting his partner. So it's not only about the exposure itself, but the after effects. So now kind of to that second question in the interview script, strategies for heat, some quotes pulled. With trees planted at the edge of the streets, it feels cooler. There are times when I have to go to the store with my 2 children, and sometimes I have to stand there in the sun. There is no tree for me to rest or for my children to relax, to breathe a little fresh air. At least it's going to feel a little cooler if we have more trees and there are parks with water fountains for the children to play and all that. And let's say roofs, so that they can be under a roof and not practically under the sun. On hot days, we end up going to other neighborhoods that have amenities and resources. I guess you can't do anything against the weather. I cannot even imagine a solution for the heat. It seems like nobody's smart enough to know exactly what to do. I think there are some smart people out there, and I don't think they know exactly what to do, but I think in partnership they may. So this brings us back to that conceptual framework where I highlighted the area I've been working in, extreme heat exposure and what that means for health. I think this could be furthered because in addition to focusing on the end of the health spectrum being heat-related mortality, I think there is a large portion of health and well-being that is it is the majority of the health spectrum that has been understudied in the heat health literature. Specifically, does extreme heat serve as a barrier to individuals engaging in physical activity, a health behavior that we know lowers the risk of several chronic diseases, including 13 types of cancer, cardiovascular disease, diabetes, and stroke. One reason to look into this is because as a health behavior, physical activity is in crisis mode. I mean, this is a type of pandemic, if you will. Only about 50% of adults are reaching the National Physical Activity Guidelines for Health and Well-Being for aerobic physical activity, which is 75 minutes of vigorous physical activity or 150 minutes of moderate physical activity or a combination of the two per week. Children are in worse shape because only about 20% of children are reaching aerobic physical activity guidelines of 60 or more minutes of moderate to vigorous physical activity per day. And we've also seen that individuals' behaviors as children may track into adulthood. So it's about starting early. So this gets to one of the studies. What is the effect of ambient temperature on trail use in Texas? Does anyone know which trail this is? Okay, kind of, yeah, exactly. So this is the Ann and Roy Butler Hike and Bike Trail, that loop trail, 10 miles or 16 kilometers, that goes around Lady Bird Lake. It's for pedestrians, it's for cyclists, and we wanted to study what was the relations between temperature across the year and the use of the trail by both pedestrians and cyclists. Now, how did we do that? This is that 16 kilometer trail loop. There's an image of it, and we looked at the entire year of 2019 at every single hour across that year because we had that data. We measured trail users because the hike and bike trail the stewards of it is a nonprofit called the Trail Conservancy, and they have these 5 electronic counters spaced along the trail. Those are the counters in the top image in white, those icons, and they collect hourly counts of pedestrians and cyclists that they sum. Observed weather conditions came from those electronic counters that have this platform within them called World Weather Online, which pulls air temperature and other weather metrics from the nearest weather station to those counters, wherever they're placed. And then using generalized additive modeling, it's a type of regression model that allows for nonlinear associations to showcase. Because the whole theory here with temperatures over the year is that at the temperature extremes, cold and hot, there may be a difference in physical activity versus kind of the middle zone, which we can call the thermoneutral zone. We controlled for rain and weekdays versus weekends. Another part of this study, so what I showcased before was observed temperatures and weather metrics and observed counts of pedestrians and cyclists. We also wanted to see how that relationship then could be thought of into the future. And we have those data that are publicly available through global climate models that NASA provides. And so we have the daily average maximum temperature and rainfall data for 2 different scenarios, the intermediate scenario, which I showcased earlier, and a high emission scenario. And what we did is we wanted to compare trail use based on the exposure response function from our observed data at baseline, so that 2006 to 2025 period, then at mid-century, and then at end of century. So I got ahead of myself. This is me explaining that. So we combine that exposure response evaluation from that observed study with these daily projections to then estimate how trail use may change into the future. So here are the observations. This is the ground data that we collected, both temperature and counts. You can see that the black curve is the pedestrians and the cyclist is the blue curve. Anytime that the risk ratio is 1 or above is when individuals were more likely to use the trail at that given temperature. So for pedestrians, it was around anywhere between 40 and about 85 degrees Fahrenheit was when they were more likely to use the trail. Yet with cyclists, it was around 60 to almost 100 degrees Fahrenheit. On the cool end, we think that pedestrians are more likely to use the trail than cyclists because they can always bundle up, wear more clothes, while cyclists create their own wind, which is called apparent wind, which may make them uncomfortable. Conversely, on the warm end, pedestrians can only take off so much clothes legally, while cyclists can create their own wind. So here are our projections into the future. These are the data from looking at the intermediate greenhouse gas emission scenario to mid-century compared to baseline, which is current times. And if you look at the left-handmost pair of columns, we see that over the full year, there's a net decrease in both pedestrians and cyclists looking into the future that we can estimate. You'll also notice across the months that there are a few months where there's actually expected to be an increase in, let's say, cyclists. Yet that is trumped by the number of cyclists that are going to be decreasing over those warmer weather months with higher temperatures.
Can I just ask
Yeah,
a question?
sure.
Would you mind going back that last?
Absolutely.
I'm just so curious. Like, I would think July and August would be very similar, and yet they're so different. Do you remember why that was like that?
Right. I think it's because in Austin, August is our warmest weather month. July, it's starting to increase, while August is when it's there. And it's starting to bleed into September. And so I think that's why the data are showing that. But in terms of why there is that large of a gap between July and August, I'm not sure.
And then May's even worse than August.
Right. That is true. At least for the pedestrians. And that might be related to, I don't know. I'd have to look into that. I think with these type of data, one thing I can mention is, if I go back a couple slides, is notice that I use about 20-year periods to identify each of these periods, or 20-year ranges to look at each period. And that's because with these global climate models, which I think there's about 21 of, you average across the 21, and then you take the average of these 20-year chunks, because you can't just rely on a single year or a single model. So as you can imagine, there's quite a bit of kind of estimate and bias that can play a role. So I think my canned response is we look at kind of the larger picture with this rather than specific to specific. I think this is that early pilot that showcases, okay, we should probably focus on this warm season period. Any other questions on this? We can ask more later too. Okay, so shifting gears a little bit, but sticking with physical activity, as we know that using public transportation is a form of physical activity because of that first mile, last mile phenomenon, in which individuals are mostly walking or biking to and from the transit stop or station. In the United States, according to travel surveys, it's about 2/3 of individuals end up walking to and from the stop and station. So this begs the question, is there a relationship between the temperatures outside and whether or not there is a bus stop shelter or a shade structure or surrounding trees on ridership? So the theory here being, on hotter days, there may be a decrease in ridership because it's uncomfortable. Yet if there is a bus stop shelter, so a shade structure, or nearby trees, it may actually protect some of that ridership loss because it's more thermally comfortable. These are two bus stops I had personally used for 3 years every day. And on the left-hand side, that is a bus stop. It might not look like one, but it is on the east side of Austin, and you don't see many people. You don't see much infrastructure there. On the right-hand side, you see a bus stop shelter. You see surrounding trees. You see some adjacent green space, and you also see people. So this study was conducted across the entire bus network of Austin, where it has about 2,400 bus stops. Of which about 1/3 of them at the time of the study had some type of bus stop shelter. The outcome of interest, the dependent variable in the study, is the total number of boardings from 1 to 6 p.m. each day per bus stop across the warm season in 2019, so that multi-month period when it's warmer. We chose 1 to 6 p.m. because that's the hottest time of the day, rather than focusing on the whole day of bus usage. The exposure variables of interest, or those independent variables, were a continuous variable for daily maximum air temperature. We also operationalized temperature as a hot day, which was defined as 97 degrees or above. That's based on being in the 90th percentile of what we call these climate or temperature normals. So it's one of the warmer days, let's call it, over the summer that helped us define this 97 degrees. So abnormally hot summer days. Presence of bus stop was one of our independent variables. That's just a binary yes, no if there was one. And then the percentage of tree canopy surrounding each bus stop. So on the images here, I showcase how those variables were created for that percentage of tree canopy. We used a Euclidean buffer with the center point being the bus stop itself, and we used a distance for that buffer of 25 meters, which equates to about a 20-second walk in any given direction. I then decided to, based on theory, to clip the 25-meter buffer if it crossed a road, because I did not think that individuals would cross the road away from their bus stop to find shade. Similarly, I clipped the buffer to not include buildings, because who's to say those buildings are accessible? Statistical analysis, we used regression modeling, and what we found were a couple things. One, we found in terms of continuous temperature and ridership that there was a negative association. So when it's hotter, people are not riding the bus as much. What we also found is that trees at bus stops, not shelters, moderated the effect of extreme heat on ridership. So if there was a tree, it protected against ridership losses when it was hot outside. This is not us canceling the idea of having bus stop shelters, okay? That is not the message from this. What it may be getting is actually at the demographic who is using the bus in Austin, in that it may be inelastic, in that they may not have another travel mode or any other given situation that they could not ride the bus. So what this is providing is shade, regardless of in thermal comfort for these individuals who may not have an opportunity to use another mode or change their daily behaviors. So some quick recommendations from this study. Why not plant some trees at bus stops? We saw that that actually protects against some of the ridership losses on extreme heat days. And not only at the bus stops, what if we planted along the routes? Because typically it takes a few minutes to get to and from a space, and that could be actually the barrier to entry. Then we know there are a host of different types of bus stop shelter designs. This could be even considered functional art. And so pick your favorite. I think some of them are more reasonable than others. So these are across the world. One of them is actually a swing. I think that's in New Orleans in the bottom left image. There's a ribbon cupping, which is kind of funny. But that's also cool because you create your own wind when you're swinging. Another idea, a contentious idea, is having the misting group. I know you. I know. They've seen this before.
We're living that down.
Yeah.
So you could install misting systems at bus stops and other public spaces. We typically see this in private spaces, such as having them at one's own residence or at a theme park or outside of a restaurant patio. But where you don't see them is for the places that are most in need for heat health decisions for those vulnerable populations. And misting systems are used across the world, and a systematic review has shown that on average, misting decreases nearby temperatures by 14 degrees Fahrenheit. That turns 100-degree day to 86. However, it depends, it's very context specific. So if you have an area that is in water scarcity, this may not be your best operation, and it depends on the hardness of the water or the calcium amounts in the water, because that can clog up the piping and leads to a lot of maintenance. And so I think this has to be intentionally applied where it makes sense. Shifting gears again, but staying with heat and physical activity, let's focus on children and how can we safely promote their physical activity as our world's warming. Here are some just quick pooled images across different types of physical activity in terms of physical activity domains. So we can see in the top left, recreating a trail system, potentially with a primary caregiver. The right-hand side, a water play, which also is a way to cool someone off while enjoying themselves, especially during the warm season. And then the bottom images are kind of structured types of physical activity. Summer band camp, that is typically done on blacktop, on pavement. And that we know is impervious surface that absorbs a lot of that incoming sun's energy and remits it as heat near the surface. And the right-hand side is summer camps. These are first inequitable in terms of access, because that takes some funds or investment to join. But then when you do join them, are the activities aligned with what one is able to do in terms of their thermal comfort? Children, specifically, are at high risk of heat-related illness and mortality, and that's because of their physical factors along with their functional factors that influence their ability to keep their internal body temperature within a certain range to be healthy. Some of these items here are listed, including they have lower sweat output, and we know that sweat, when it's on your skin, evaporates in the air and cools you off. In addition to having these physical and physiological differences in adults that make for difficulty with thermoregulation in children, children are also still developing in terms of their functioning. So we know in terms of brain development, a child's brain at 5 is very different than a child's brain at 20. In addition, children are often dependent on another, and so they're kind of wedded to a system rather than making their own decisions. Here is a fully completed study that was funded by the Robert Wood Johnson Foundation under their Health and Climate Solutions program, where I had partnered with Melody Alcazar at the City of Austin's Park and Recreation Department to conduct a 2-year study to look at children's health in high temperatures specific to schoolyards. What you can see in this photo are children in some type of playground, and they're under shade. What you cannot see in this photo is it was over 100 degrees out that day. So the impetus for this study is that most children in Texas are not sufficiently active, and there are differences by race ethnicity. Here are data across the state of Texas collected by the research center I work at through the Texas School Physical Activity and Nutrition Survey. It shows the percentage of children meeting the physical activity guidelines in Texas. We see that white in those that have been categorized in this case as those other races and ethnicities not listed are less active or more active than Black and Latino children, yet overall, most children are not physically active in Texas in 4th grade. So this begs the question, is extreme heat a barrier to those engaging in physical activity? So this project had a few specific aims. It was to determine how green features, trees, gardens, nature trails at elementary school parks impacted temperatures within the parks, the physical activity levels of Latino children from low-income households, and how these children's connection to nature related to their social-emotional learning skills. We focused on 3 school parks that had been identified by the City of Austin as having low nature access and inequitable access to nature. And so they had their own metric to define that. These school parks were also at schools serving over 85% economically disadvantaged households that were also over 85% Latino. We structured the study to be 2 weeks in September and 1 week in November because in terms of the school year, September is a higher temperature month, and we want to do a comparison against a more comfortable month potentially, being November. We tasked 213 total 3rd and 4th grade students, which are about ages 8 to 11, to wear an elastic belt equipped with an accelerometer and GPS device, which measures their physical activity and their location, so we can understand where they're moving in time and space and how active they are while they're moving. They wore these during 20-minute recess periods over those 3 study weeks. We measured green features as well as artificial shade structures by drawing or digitizing polygons within GIS using high-resolution ortho imagery that had been provided by the U.S. Department of Agriculture's National Agriculture Imagery Program. And we also measured temperatures within each of the 3 school parks by installing these air temperature and relative humidity sensors based on a few criteria, which I think I show in the next slide. Yeah, so of those 3 parks, here's one of the 3 parks, the Intervention Park. And this is also in that Runberg neighborhood that we showcased in that earlier study that had higher urban heat-island intensity. There are 10 sensors, and they were spaced to have more or less equal spatial distribution, so we could then model temperatures between them and create a complete thermal profile. We also tried to capture different land covers, such as grass, pavement, and mulch, and land uses, such as a basketball court versus a playground. In terms of that last aim, children's connection to nature and how it relates to their social emotional learning skills, we measured their psychological connection to nature from a validated index called the Connection to Nature Index, which has 16 survey items on a 5-point Likert scale asking about their level of agreement with different statements. To get that singular value, you just average the answers across those 16 items. We measure children's social emotional learning skills through a already ongoing survey conducted by the school district, a student climate survey, which includes 10 items that specifically get at SEL skills. SEL has been defined as kind of 5 core competencies through the CDC and Kaiser Permanente. It includes self-awareness, self-management, relationship skills, social awareness, and responsible decision-making. And those were on 4-point Likert scales, and we also identified an overall SEL score, which was just the average across these 10 items. Okay, now for some data. So in our results, based on those air temperature and relative humidity sensors that I had placed out, we were able to compute heat index, which is just a combination term for air temperature and relative humidity that captures how it really feels. And we did this at each of the 3 school parks for that September period. Here we see one of the school parks that I actually showcased in the last image with the temperature sensors. The hottest part is the red area, the coolest is the blue area. The unshaded area was the hottest. It reached 114 degrees Fahrenheit during September, and this is, remember, air temperature, not surface temperature. And that is showcased by the top right image, which is an unshaded playground. And just 50 meters south was the coolest spot in the park, and that's shown by the unshaded, or the shaded playground, which is 50 meters away and 10 degrees lower in temperature. And then from those belts of accelerometers and GPS units that the children were wearing during recess for 3 weeks, we were able to showcase that as temperatures rose, children's physical activity decreased, and they sought shade. So here we show the percentage of daily recess time over average daily temperatures, specifically the percent of time spent in moderate to vigorous physical activity and the percent of time spent in shade. You can see at about 91 degrees Fahrenheit, that's when there's that inflection point where a larger percentage of time was under shade and not being physically active. And then for that last aim, we did find a direct association between children's connection to nature and their overall SEL skills, and then 3 of these core competencies. We have a few recommendations from this study that's now been completed. The first kind of batch is related to environmental interventions, so changes in the space and the place, and then recess policies are programmatic interventions. So let's green schoolyards. One other finding I did not showcase is that the school with the largest amount of tree canopy had children spent 6% more time during recess engaged in moderate to vigorous physical activity than the school with the least amount of tree canopy. Add shade to areas intended for physical activity. Let's cover those playgrounds. Let's also add shade to areas intended for rest, because we don't expect children to play 100% of the time. And anecdotally, we noticed that instructors that were watching over the children, they tended to cut recess a bit short on days when it was really hot outside. So let's provide space to actively sit and enjoy. In terms of programmatic interventions, changing when recess is occurring, we also have to acknowledge the school setting and the context, where recess is considered a mental break and a physical activity break for children. So we don't want to put this as the first thing in the morning when it is cooler, because that's not supporting children's well-being during school, or let's call it the staff well-being as well. So perhaps it's just not putting recess during the hottest part of the day. Then it's working with staff to organize a shaded play on extreme heat days. So that could be programming, that could be adding a frisbee and making sure it's played in an area that's been shaded, or playing at the shaded basketball court. And then there's this idea of shifting recess from outdoor spaces to indoor spaces at schools. Yet at schools, we know that many places are kind of multifunctional, especially like the gym, where the schools are already stressed indoors with scheduling. We probably don't want to continue to stress that. And then also, children and adults spend about 90% of their time indoors already, where there's not really much access to nature in there. So playgrounds can be spaces of nature, and we can talk about a definition of nature for a while after this if you'd like. But we want to have as much nature contact as possible, just in terms of what that could mean for health and well-being benefits. Then I snuck in this kind of bonus study here just to finish up, because we just recently conducted it. We also used those elastic belts with GPS devices and accelerometers on younger children. So that previous green schoolyard study was children 8 to 11. This is 3 to 6 years old, and this is another setting. This is early childhood education setting, and this was done at the UT Early Childhood Education Center lab, which takes on individuals from the public. And so what we found was on hot days, preschoolers are less active during outdoor play. These data may all seem like, well, duh, this makes perfect sense, but we do need to have evidence that's done with strength to then make those ultimate decisions later. And so we see that children are being less active in terms of they're being sedentary, they're sitting still when it's hotter. and they're spending less time in moderate to vigorous physical activity. And this is during a 40-minute chunk of time. So this has bigger implications, let's say, than that shorter recess period for older students. And so lastly, I just want to follow with a quote that is, I think adapts well to my climate equity work, and this is from the disability rights movement in the 1990s in South Africa. It is nothing about us without us is for us, in that those facing climate inequities must be meaningfully involved in designing the solutions for those solutions to be truly effective. Then I had this kind of summary slide. So while average temperatures are increasing globally due to climate change, cities are also warming for other reasons, the urban heat island effect. Every one of us is affected by extreme heat, yet it is unfairly distributed, especially based on income level and race ethnicity, especially in the US, and if you think country to country, high-income countries and low and middle-income countries. Extreme heat is associated with lower levels of physical activity of adults and children. This has typically been kind of a covariate in models rather than being a focus of research. And so I think it's time we focus on this, as we've seen that there are differences there. And then lastly, there are different types of interventions that can promote not only health, but the safety and overall well-being of individuals as we're warming. And so none of this work would have happened if it wasn't for these people. These are collaborators at UTHealth School of Public Health in Austin, UT Austin, City of Austin, multiple departments, and Go Austin, Vamos Austin. So must thank them. And thank you for coming today.